We are on question number 50.
Okay, ma'am.
Ma'am, this file is empty.
Yes, ma'am. This
July
file is
2018?
not opening.
Yes, ma'am. Ma'am,
So that
can
your
you
voice
please
is too low.
now audible?
No, it's audible, but it's low in volume.
Visible? Audible, sorry.
Yeah, it's much better. Yeah. Say.
Ma'am, can you please share a solved paper of February 2020, July 2000? I have message in group.
No, actually, I've just marked the key in the questions that we have just because the questions are not complete questions for these two paper. Neither the
Poetry,
options.
July 2019, February 2020, and September 2020.
Yeah, so if you go up, when we discuss the questions, like I post in the group and then we discuss it. So I've just marked the answer keys over there only.
In discussion, ma'am.
Yeah, in the discussion, if you scroll up, and you'll find it.
Okay, ma'am. So I have to when I listen recording, so I found the answers.
Yeah.
And ma'am, one thing more. The file which you have sent it, these are not opening. This is empty.
Sorry, which one?
Now the July 2018 one.
Hmm.
This is empty, ma'am.
No,
The
now
new
again I have sent it.
one. Sadaf, check the new one that ma'am shared
Okay.
now.
Okay, thank you.
Question number 47.
Okay. Uh, Ma'am, question numbers are not mentioned.
Okay, let me see. Yes, the question numbers are not written. Okay,
Yes,
let me
we
see on
did
which
it
question we were.
for
Yeah.
yesterday.
Okay, we are stuck on above. This question number 47. What is January 18? After dying, no, this is done. Let me see, is it January then 2018? Because the questions are marked over there. January. In 2018. No, 2018. No, let me see. 47. No, we did this paper. No, we did this paper. Okay. Yeah, let me tell you which question number.
Ma'am, we studied till that deep circumflex iliac artery is a branch of
Yeah. That's what
external
I'm
artery.
searching. Yeah, that's what I'm searching. Can you see it here? Where it is?
Yes, ma'am. That is page number 10.
10. Okay.
9 is 10.
10. Okay. Yeah, in black artery. Yes. Yeah. Very good. Yeah.
Sadaf, you got it?
Odensterone. Page number 10 is
Yes,
odensterone.
yes, a few MCQs before
Yeah.
that. Structure differentiating external iliac from femoral artery.
Hmm.
Okay, okay, got it.
Should I start?
Yes.
Structure differentiating external iliac from the femoral artery inguinal ligament. And that will be, ma'am, dividing it, no? That is the inguinal
Yeah, it will be
ligament.
dividing it. But that will convert into external iliac into femoral artery.
Yes, yes. Which structure differentiates superficial perineal pouch from deep perineal membrane?
Hmm.
And Bartholin occupy which space? Superficial perineal pouch. And vestibule is between two labia minora. And
Hmm.
ondansetron inhibit what? Ma'am, that is the 5-HT3 receptor in the
Hmm.
stomach. In the brain, sorry.
Yes, in the brain. Yes.
Mhm. So, and then positive predictive value of question was 75. Ma'am. And the
Hmm.
other question was 3 mode. Yes, ma'am. So it's not complete. And
Yes.
question molar pregnancy fertilization. And first two pictures, last two for partial, and 2 and 3 are complete mode. Ma'am, and these are also not given. But OVA without DNA material. And on ECG, heart block, third degree heart block was there. And ma'am, it is HLA and HLB not present. What is it?
It is HLA and H. Okay, okay. It is saying that HLA and HLA-B are not present. What is HL? Hmm. No, even I don't understand what is HL.
Okay, ma'am,
Ma'am,
they
those
may have
HLA,
put.
B, C, D were the
That
presence
one.
of. Yeah, maybe
So
that
where
one.
they are not? No. Then where are they not present? They're present in.
Placenta.
Okay.
Then G and other
G is
complexes
present in
present.
the G is in the extratrophoblasts.
Yeah, this
Extratrophoblasts.
was a question we discussed it.
Okay. Yeah. Yeah. Then they're asking like this. Okay.
Question on CTG picture, no history of read paper on CTG. Now it's also incomplete. And
Hmm.
fetal blood sampling and repeat after 30 minutes. Type
Hmm.
1 cesarean section, continuous CTG reassess after 30 minutes. Uh, it was reassuring CTG, but because of meconium grade 5 have to continue. Okay, ma'am. So they must have given the picture and
Yeah.
after.
Yes.
Question on oxytocin, why not given orally? Because of GIT enzyme, it is destroyed.
Hmm.
That's why we didn't give it. And then human placental lectin, it is HPLC.
Hmm. No, it is human. It is not. It is human chromatography. Human liquid chromatography.
Okay, ma'am.
Hi.
We'll peak at A2, and S. Hemoglobin F normal.
Hmm.
Interpretation. Alpha thalassemia, beta thalassemia, sickle cell trait, normal interpretation.
So what it is going to be?
Ma'am, it's okay. It's hemoglobin A2, and S and F. They are saying that it is normal.
Yes.
Ma'am, if hemoglobin F is normal, um, ma'am, normally we have adult hemoglobin, that is hemoglobin A, and
Yes.
hemoglobin A2 is if also present in a small amount along with the hemoglobin A1, then it is thalassemia minor. beta thalassemia minor. And if hemoglobin A2 is more present, then it is beta thalassemia major. And in the sickle cell, we have hemoglobin S more. And in the alpha thalassemia, we have hemoglobin F. So, ma'am, here they have just shown that hemoglobin F is normal in interpretation. They must have given some picture, ma'am.
Yes. Yeah, they must have given. Yes. So tell me what you in this by looking at this something, can we put it into interpretation? We can't put it because they have not given something like
Because they have
properly.
shown, said that hemoglobin F is normal. So, hemoglobin
Yeah.
F is normal in normal, like it is not present in adult normal
Hmm.
hemoglobin.
Yeah,
And F,
exactly. It
if
is
it
not.
is present, then it shows alpha thalassemia.
Yes, it is then present. It is going to show. Yes.
And sickle cell trait, in sickle cell, we will be having hemoglobin S.
Hmm.
And also hemoglobin A will also be present, adult hemoglobin.
Yes, adult hemoglobin A will also be present. Yes, very good.
And F will be present.
Hmm.
And finasteride act on 5-alpha reductase enzyme
Hmm.
that will convert androgen into dihydro and androsterone, active
Hmm.
form of androgen,
Yes.
5-alpha reductase. And primary amenorrhea, absent uterus, FSH6, ovaries normal, karyotype 46XX, and diagnosis MRKH, because uterus is absent and there may be blind vagina or like Mullerian agenesis is there,
Yeah,
so
Muli.
MRKH.
Yes, yes. And what happened in case of AIS?
In case of
AIS, androgen insensitivity.
ma'am, in androgen insensitivity syndrome, the genitalia will be present, but
Hmm.
ma'am, the male organ will not develop properly. So the external genitalia in the male will not, testes will not, external genitalia will not develop properly.
Yes, very right.
And odd ratio answer is -4. And pedigree chart, X recessive, X linked dominant, ma'am, again it's incomplete.
Hmm.
Um, ultrasound picture showing dichorionic
Which
diamniotic
paper we
twin.
are solving? 2018?
2018,
Please.
and this is the page number
Okay.
11. Recently, ma'am, have shared it last one,
Okay.
page 11.
Mhm.
And ultrasound showing dichorionic diamniotic twin. So two placenta, dichorionic, and two amniotic cavity will be present.
Yes. And what sign will be present?
And monochorionic diamniotic, ma'am, in dichorionic diamniotic, clear partition will be present. And
Hmm.
in monochorionic diamniotic, T sign or lambda sign will be present.
Hmm.
Um,
No, lambda sign is different and T sign is different.
okay, ma'am. T sign is present in monochorionic diamniotic and lambda will be present in dichorionic diamniotic. Am I right,
Yes.
ma'am?
Yeah.
Because T
So
sign is
just
very
simply says
slight.
that in for dichorionic it is lambda sign and T sign it is for monochorionic.
Okay, ma'am. And fetal skull showing parietal bones. So, ma'am, it will be present on both sides. And fetal head is said to be engaged when BPD passes through which of the epidiameter Meyering? 11 centimeter, 12 centimeter, 11 centimeter, antero posterior diameter, Ma'am, head first engage in a transverse position.
Yes, so what it is going to be? What will
Ma'am,
be the diameter?
ma'am, then 13 centimeter diameter is the
Yes, at
longest.
the inlet transverse diameter is 13.
13. And then it with the flexion and internal rotation it get rotates, and then finally at the when it get has to be delivered, then the anteroposterior diameter
Yeah, it is given in AP diameter, yes.
chromosome 2 diagrams. Is it inversion hydrogen containing buffer in the urine. Ma'am, phosphate buffer we
Yes,
studied that
phosphate in the
in
yes.
urine.
Wrong written.
Phosphate buffer. Ammonia is synthesized by action of which enzyme?
Hmm.
Ma'am, it is synthesized in the liver,
Hmm.
and the enzyme involved is
What is the cycle that is?
ma'am, urea cycle.
Urea cycle produces urea and um, what else it produces urea cycle? Hmm. Hmm. Urea cycle takes place in. Okay, you have to tell ammonia is synthesized by the action of which enzyme? Mhm. Ammonia. Mhm. Now forgetting things. I'm also forgetting. Mm, ammonia. It is going to be. I think it's that it is, but it is glutaminase or glutaminase dehydrogenase. There were two enzymes like that, no?
Okay,
That we
ma'am.
did. It's it's glutaminase dehydrogenase
Okay, ma'am.
that will produce in the renal tubular cells.
Okay, ma'am. And urea cycle takes place in the liver, ma'am,
Yes.
and glycolysis in cytosol,
Mm.
and cytosol glutaminase liver cytosol, and glycolysis in cytosol. Glycolysis basically takes place in the liver if we see, like it is stored in the liver. But if they are talking about, we studied about its two parts, that is one in mitochondria and one in cytosol, ma'am, I think.
Yes, you're right.
So, ma'am, its answer is cytosol.
Yeah. Yeah. Here it will be cytosol because it was again it's a repeated question. Previously also they've asked.
Yes,
That's why.
ma'am. Microscopic picture of diplococci, gonorrhea, chlamydia, gonorrhea, gram-negative
Yeah,
diplococci.
gram-negative diplococci.
Yes, ma'am. Angiotensin 1 to angiotensin 2 conversion takes place in the lungs.
Hmm.
And angiotensinogen into angiotensin 1 takes place in the kidney.
Yes.
And teratogenicity of lithium, aminoglycoside, and tetracycline. Heart, ma'am, lithium, it is,
Hmm.
uh,
Lithium causes which abnormality?
ma'am, cardiac abnormalities and
Yes, which cardiac abnormality? Yes, it causes cardiac. Which cardiac abnormality?
teratology of
Abstinent
No.
anomaly.
Yes, it causes Epstein anomaly. Yes, very good. It's a repeat question. It was there in
yes,
previous also. Yeah.
aminoglycoside 8, cranial nerve damage, hearing,
Or we can say autotoxicity also.
autotoxicity.
Yeah.
Tetracycline, it causes teeth discoloration. So if we say that in the child, the mother who has took the tetracycline during pregnancy, the child will get the teeth discoloration in the adult.
Yes, exactly. There's a chance that the teeth of the child will be affected.
Okay. And clue cells of bacterial vaginosis are vaginal epithelial cell. And
Yes.
we studied it in M cell criteria, clue cell
Yeah.
diagnosis. And treatment of listeria is amoxicillin, cephalexin, azithromycin. Amoxicillin, A.
Yes, very good. It is amoxicillin. It is the drug of choice.
Okay. Human papilloma virus type causing what? Other one for types causing high grade intraepithelial dysplasia. So, high grade neoplasia after vaccination. Ma'am, in human papilloma virus, we studied that 16 and 18 are very dangerous. They are causing basically carcinomas, and the other types are causing genital warts as well.
Hmm.
So that
Very
is
good.
what I think they are
Hmm.
saying. And high grade neoplasia after vaccination.
Hmm.
And 33 filamentous insertion of placenta.
Hmm.
And epithelium of fallopian tube is simple columnar epithelium.
Yes.
And epithelium of distal urethra is stratified squamous epithelium.
Yeah.
And in the bladder, we have transitional epithelium.
Yes.
And
Ma'am, it's stratified squamous or simple squamous?
You tell
Urethra.
us.
Ma'am, it's simple squamous.
Yes.
okay, it's simple
It's simple
squamous.
squamous. The question is that near the distal end they are asking. This question is also previously also written, na? In the
Yes.
Okay,
one of the papers it was there. Were there they were
okay,
talking that what is the epithelium at the distal end of the urethra? That is going to be a simple squamous.
okay. Chromosome with centromere towards one side. Telocentric, acrocentric,
Ma'am,
centromere
we didn't
toward one
solve
side.
this mystery yet.
Telocentric. Yes, any other option. And
Yeah, we'll do it.
telocentric is
Problem,
absent
no problem. We'll do it.
in the
Jesus.
human. And question mentioned near the end.
Hmm.
And carcinoma with endometriosis,
Hmm.
clear cell. There was a, ma'am, what is it? Carcinoma with, ma'am, it's incomplete question. Carcinoma with endometriosis, clear
Hmm.
cell.
You have to mention
Okay,
there was all the
yes,
options were there, like clear cell carcinoma, other
okay,
options were
ma'am.
also there. And you had to tell that which of these carcinoma they are associated with endometriosis.
Okay, ma'am. And there was a question asking to calculate the mode. I think that option was the one question 29. Okay, three were must be answered. And carcinoma of the vulva,
Hmm.
squamous cell carcinoma.
Hmm.
And most common degeneration in fibroid is hyaline degeneration. And in pregnancy, we have red degeneration.
Yeah, in pregnancy we have radiation.
And most common type of bacteria in endometritis is streptococcal A.
Hmm.
And CTG of low risk primary gravida 39-week had ARM with meconium stained liquor. CTG for 55 minutes shows decreased variability or variable deceleration.
Hmm.
So, 30-minute monitor, grade 1 cesarean section 2, and fetal blood sample. So, ma'am, it is just showing meconium and decreased variability. So, it is not a pathological one. So, we will wait for 30 minutes.
Yeah, we will wait because in pathological only we do FBS.
Yes, ma'am. And supraumbilical versus
Ma'am, we will
supra.
monitor for 30 minutes.
Yes, we will
Yeah, we will
monitor for
monitor.
30
Yes.
minutes. And along with that, conservative Myers we will do.
Yeah, that.
And supraumbilical versus suprapubic
Bettina,
incision.
your
Yes, yes.
voice is not clear.
Okay. Now it's clear.
Yes, now clear.
Okay. Supraumbilical versus suprapubic incision. Which layer is not encountered in suprapubic incision? Posterior rectus sheet is deficient in the lower part. Yes, ma'am. So that's why it's not present. And first polar body, first polar body.
This is the diagram.
Okay, so it's not visible much. And maximum radiation exposure in hysterocontrast sonography, hysterosalpingograph, lap and dye test,
Hmm.
hysterosalpingogram, maximum exposure will occur.
Hmm.
HSG.
Yes. And at
And
what day we do HSG?
what, ma'am? At
At what
what
day?
day?
Yeah.
Ma'am, after 5 days, like 7 days, we will do it.
Yeah, 6 to 12 days. This is
6
the
to
also
12
a
days.
repeat. Yeah, this is also a
Certificate
repeat question from the.
documents is we
Hmm.
will do it. And crista present in mitochondria and
Hmm.
liver and biliary cells are system are differentiated by invagination of what structure? Dorsal mesogastrium, ventral mesogastrium. Ma'am, ventral mesogastrium.
Um, Ventral. Yes. Yeah, ventral. Yes, ventral.
Mhm. Septum transversum, corpus luteum. Okay. No, they have also liver and biliary system are differentiated by invagination of septum transversum.
Okay, they've given the option down also. Okay, okay,
Mhm.
okay. Yeah, and okay, okay. I thought this option is with this diagram. No, it is with
Yes,
this. Okay, then it is going to be septum transversum, which
mhm.
also forms what? Septum transversum forms one thing more. Can you tell us what does septum
Ma'am,
transversum forms?
ma'am, it's septum transversum, septum secundum of heart,
Interatrial septum or atrioventricular.
interatrial septum that will form septum,
This
septum
forms
prime,
enter atrioventricular septum.
atrioventricular septum. Okay.
Yes.
And
Yeah.
septum primum and septum secundum will form ostium primum and
Interatrial
ostium
septum.
secundum in between the interatrial.
Yeah. Yeah. Very good. Yes.
And corpus luteum, corpus albicans. It's
Hmm.
corpus luteum picture. Okay. And a girls on a hill track respiratory alkalosis. The respiratory base balance pH 7.2,
Hmm.
that 7.2. Carbon dioxide 8.2, bicarbonate 25, respiratory alkalosis.
Hmm.
Respiratory alkalosis, ma'am, we have opposite. That is, pH is decreasing and bicarbonate will be more.
Yes,
So
bicarbonate
pH
will
is
be more.
in
Hmm.
respiratory. In respiratory alkalosis, sorry, pH will be high and bicarbonate will be low.
Hmm.
So pH is high 7.2, more than 7,
Yeah, 7 is high, pH is high, PCO2.
and bicarbonate is 25.
Yes.
It is low.
So what it will be?
Once a minute, ma'am.
Hmm.
In respiratory, opposite.
This
Mm,
is repeated question, Rubina.
Yeah.
pH is once a minute.
It's fourth time.
pH will be high and bicarbonate will be low. Ma'am, in respiratory alkalosis, pH will be high, bicarbonate will be low.
Hmm.
So pH is 7.2, it's high, and bicarbonate is low. Am I right, ma'am?
Yes, you are right. Yeah.
Okay. And IgM pentamer by J chain, L chain, Mu chain, lambda chain. And asking on heavy chain on IgM.
Yeah,
What
read this
was,
explanation. Can you understand what is it in this meltimerization of IgM?
yes, ma'am, 2 IgM monomer in endoplasmic reticulum. And ma'am, it's what it's written? Cistern.
The FC region is shown in the diagram.
Yes, ma'am.
Then the cysteines in the J chain,
Yes, yes.
they form the
Oh,
disulfide bonds, which
with
cysteines form from each other, from each monomer to form a dimer. A J chain then detaches, leaving the dimer disulfide bond. Then the J chain, it captures another IgM monomer and joins it to form a dimer. The cycle is then repeated twice more. This J chain remains attached to the IgM pentamer. So now here
okay,
what
ma'am.
will be your answer?
Ma'am, it will be J chain.
Yes, it is going to be J chain.
Yes, ma'am. And previous 3 sections placenta now invading into the serosa, so percreta. And male infertile, small soft testes in the scrotum, high FSH, testosterone normal. Anabolic steroid, congenital absence of vas, testicular failure, seminoma, vasectomy. So, congenital absence of vas difference.
Yes, congenital absence of vasectomy. Yes, very good.
And why elevated FSH and normal testosterone?
Hmm.
Why elevated FSH and normal testosterone?
Very good.
Testicular failure.
Hmm.
And in testicular failure, because there will be more stimulation to produce FSH.
Hmm.
And M
The unit of MRI. Tell us what will be the
unit of
unit of MRI.
Tesla.
Yes, very good. It is going to be Tesla.
And site of vasopressin production, supra and paraventricular nucleus.
Yes.
And diathermy burns at high density small return plate, low density earth, low density small return plate, high density plate. And in DEXA bone mineral density scan, the results are reported into which two ways. The Z-score compare the individual to the young adult where normal is greater than minus 2.5, and the T-score compares the individual to another individual of the same age and gender. The Z-score compares the individual to a young adult where normal is greater than 0, and T-score compares individual to another individual of same age and gender. Z-score compares the individual to a young adult where normal is greater than minus 1, and T-score compares the individual to another individual of same age and gender. The T-score compares the individual to the young adult where normal is greater than 0, and Z-score individual to another individual of same age and gender. T-score a young adult with the normal is greater than minus 1, and Z-score compare the individual to another individual with same age and gender.
Hmm.
Ma'am, minus 2.5 A.
No, A.
Would you-
Why A? Any other option? Yes, what do you, yes, yes, Nupur, Fakra, Sadaf, what do you
Oh,
say?
minus 2.5 will show that its density is very low.
Hmm.
It has osteoporosis.
Hmm.
So we will compare it with 0.
Zero.
-1.
Hmm. So what will be your answer? Yes, Sadaf, tell us. What will be your answer then?
Ma'am, Z-score compare the individual to young adult where normal is greater than -1.
Hmm.
And T-score compare the individual to another of the same age and gender. Ma'am,
Yes,
the
option E. Yes, option E is the correct one here. Read it
Okay,
for
ma'am.
us, Rubina. Can you read it so that you?
Okay. T-score compare the individual to young adult where normal is greater than -1,
-1.
and Z-score compare the individual to another individual of same age and gender. And ma'am, we have the criteria also for that now, that is from -1 till 2.5 we consider it as os-
Greater than -1, like matlab less than -1. It's normal
okay.
-1 to 2.5.
-1 to
And
-2.5, no?
5, yes, it is
Osteopenic and that more than osteoporosis.
Okay.
osteoporosis, and the last one more than minus 2.5 was
Osteoporosis, severe.
severe osteoporosis. Yes.
Hmm.
Okay, thank you. And second common cause of congenital adrenal hyperplasia, alpha beta hydroxylase enzyme deficiency. And common type of the valvular cancer, squamous cell carcinoma,
Hmm.
and placenta invading the myometrium onto the serosa. Ma'am, if it invades into the serosa, then it is percreta.
Yes.
So, ma'am, they have also written that in Creta, why it's invade serosa, it was
Yeah.
into the serosa, it has
No, but
not.
just keep it as your concept that
He
whatever,
has
because I
written it
think this.
at the end that it's
Yeah.
percreta. I was onto this cirrhosis, so I thought it's not invading you.
Yeah, just make your concept that you have to understand what the statement is,
Yes,
because I
ma'am.
think in the exam there's a proper statement for this. It is
Ma'am,
always a confusing
yeah,
one whenever it has come this question.
invaded the serosa or it has just reached it, so that will be the return. It will be written.
Hmm.
Okay, ma'am. Post laparoscopy, lower abdominal tenderness with oozing, port site infection. Ma'am, it is. And retention wasn't there, a palpable cystic mass. Ma'am, we have done this MCQ
Mm-hmm.
previously,
Yeah.
and
Yeah,
that
yeah,
was
they
like,
repeat. Many of the questions they are repeated. That is why you are feeling, yeah.
yes, ma'am. Retention wasn't there, a palpable cystic mass. I would be wrong. Okay. Urinary retention, primary function of DNA polymerase, DNA polymerase is ma'am in the uh, co- uh, in the transcription it is involved, ma'am.
Yes, it is involved in the transcription.
Mhm. And uh, added nucleotide DNA repair, um, skeletal muscle embryology from where except skull, endoderm, exoderm, neural tube, neural crest, paraxial mesoderm.
Hmm.
They are marked paraxial
And
mesoderm.
biology, where accepts and
Okay, it was skeletal development except skull, so it's paraxial mesoderm. Which HLA not I extra villus trophoblast?
Hmm.
extravenous
A and B, ma'am.
Yes.
Ma'am. A and B will be option there will be given, and we don't know.
Hmm.
And CT scan post hysterectomy, renal stone, pelvic hematoma, and ureteric obstruction. Ureteric obstruction. So, ma'am, it uh, Hirschsprung disease absence of neuron. Ma'am, renal stone is present in the pelvic hematoma is present, so it must be ureteric obstruction due
Yeah,
to
it
the
must be
stone.
causing ureteric obstruction.
Yes, ma'am. And which sympathetic or parasympathetic?
Is absent in case of herping disease? Tell us. This is also a repeat
Also
question.
repeated question.
Yeah.
Ma'am, parasympathetic.
Yes, very good. Parasympathetic is absent in case of this, what we call.
And pregnant woman at 22 week with group B streptococci in urine more than 1 lakh. Then give intrapartum GBS treatment, perform GBS and then treat UTI and treat culture during term, and if no GBS, no treatment.
Mhm. Yes.
Treat UTI and give intrapartum antibiotic prophylaxis. As
Hmm.
ma'am, GBS is positive in the current pregnancy at 22 weeks,
Hmm.
so we will give antibiotic because it is a scenario that we give antibiotic. In that case, if it is positive in the current pregnancy or
Yes.
during labor, if it is
It's
positive.
positive. Yes.
And treat UTI and test again prior to labor. I did treat urine according and intrapartum antibiotics.
Hmm.
Nerve from medial border of the psoas muscle, obturator nerve. Okay. Adductor of thigh is obturator nerve, and obturator nerve is most commonly injured nerve in gynecological procedures as well.
Yes.
And bifurcation of aorta takes place at L4 level.
Hmm.
And lateral boundaries of ischiorectal fossa, that is obturator fascia.
Hmm.
And letrozole is aromatase inhibitor that is used for ovulation induction.
Hmm.
And antiemetic with involuntary movement, metoclopramide, it causes extrapyramidal effects.
Hmm.
An enzyme in the granulosa cell, not in theca cell, aromatase enzyme. Okay. Which
Hmm.
nerve passes medially by psoas major muscle? Ma'am, we studied now obturator nerve,
Yeah.
and now they have marked the genitofemoral anterior obturator medial. Okay. So they have asked medially, so it's obturator now,
Yeah.
obturator. And the rest of lumbar plexus nerve lateral from lumbar plexus. Androgen secreted from which cell under LH? Leydig cell.
Hmm.
Leydig cell yes, ma'am, produces androgen. And Sartori cell phagocytosis in testes. And mild dyskaryosis, which human papilloma virus responsible? Ma'am, human papilloma virus 16 and 18 causes basically the CS 16 and 18, and they will also cause in the start mild dyskaryosis as well.
Hmm. Yeah,
And
very good.
so it must be these ones. And histology of endometrium in follicular phase with the graph of hormone proliferative phase. So they
Hmm.
have marked estrogen.
Yes, it is going to be the estrogen one. Yes.
Estrogen, yes, ma'am. Biopsy if taken at arrow point. What is histology? Option proliferative secretory luteal follicular. Ma'am, it is the follicular phase arrow because proliferative phase because it is a menstrual cycle. So
Hmm.
proliferative phase will be present there
Yeah, proliferative phase
because
in which
it
the
is for 14 days, na?
yes,
And
it's
then
near
later on the
14 days.
secretory phase will be there.
Hmm.
AMH as ovarian reserve. If you want to check the ovarian reserve, we do AMH. And nerve supply of the bladder, greater splanchnic, lesser splanchnic, pelvic splanchnic, hypogastric. Hypogastric, it's sympathetic, inferior hypogastric.
Hmm.
Ma'am, nerve supply of the bladder.
Hmm.
Hypogastric, it's not pelvic splanchnic or
Blood supply.
nerve supply, nerve supply.
So, yeah, sorry, nerve supply. Yes, bladder, no
There's
bladder.
one
It is
sympathetic and parasympathetic and somatic supply.
yeah,
Sympathetic from inferior hypogastric and the other one is
exactly. Yeah, in the exam they will
Yes,
have
yes,
written
yes.
it completely. Whether they're asking you the sympathetic, they're asking you the parasympathetic, they will tell you.
Okay, ma'am. Cycle length 21 to 35 days variability due to
Hmm.
variable follicular phase, positive feedback of estrogen, fail to positive feedback. Um, Ma'am, 21 to 35 is due to variable follicular phase because
Hmm.
the secretory phase is fixed 14 days.
Yes.
So that is what they are asking.
Yeah, that is what they're trying to ask from
Yes,
me.
yes.
Yes.
Because that is fixed 14 days. Okay. Structure passing, ma'am, free T4 level is 0.1%.
Hmm.
Structure passing through lesser sciatic foramen, pudendal nerve, obturator tendon. Yes, ma'am, they pass through lesser sciatic foramen. And thromboxane A2 produced in platelets. And anticonvulsant therapy, hemoglobin low, which type of anemia? Folic acid, yeah, deficiency. Yes, ma'am, because always with anticonvulsant like anti-epileptic and these folic acid deficiency will occur. So
Yes, it is going to be
congenital
folic
anemia.
acid deficiency.
Yes, ma'am. Intense vasospasm before menstruation is due to prostaglandin F2 alpha, and that is also involved in labor initiation as well.
Hmm.
And coronal suture between which bones? Ma'am, it is between the frontal and the parietal bone.
Hmm.
And the sagittal suture is present between the two parietal bone.
Yes, it is
And
between
the
the two parietal.
occipital suture is present between the occipit and the parietal bone.
it's called
Hmm.
lambdoid suture as well.
Sorry, that is lambdoid suture, yes. And anteroposterior diameter of pelvic inlet is 11, and the transverse of the inlet is 13.
Hmm.
That is the larger, and opposite is in the case of the outlet.
Yes.
And our primary is informed that engagement has occurred which is anteroposterior diameter of the inlet through which biparietal has to uh, cross.
Hmm.
Head has engaged, and which is the anteroposterior diameter of the inlet. Ma'am, 11
11. Yes.
in the inlet,
Yes. In the
anteroposterior.
latest 11. Yeah.
And thromboxane released from the platelets. And
Yes.
high level of beta HCG is present in theca luteal cyst.
And
Mm,
AH is Rubina.
yes,
Luteinizing hormone is more in dysgerminomas.
okay, yes, dystrophy. And beta HCG is more in
No, this is we have.
what?
I'm just revising. Beta
Okay,
HCG in thecal lutein cyst, right? Luteinizing hormone in dysgerminoma and estrogen, raised estrogen in
in
Bachra know this, right?
yes, I don't
Est-
remember well.
we have.
Yes.
I'm
Tell
learning.
us where it is
I'm
going to be.
Estro, ma'am, it skipped from my mind.
Estrogen is higher in granulosa cell tumor.
And beta HCG in thecal lutein and luteinizing hormone in dysgerminoma.
Yeah.
Okay.
Okay.
And 34-year-old with 4 centimeter simple cyst, we will reassure her and we will send her home.
Mm.
And which nerve passes medially by soft major muscle obturator nerve. And MCH1 extravilus absent in HLA and HLA-B. Okay. And radiation exposure background risk equal to 1 X-ray. Repeat X-ray in ma'am
Yes. Tell us.
PE.
Repeat X-ray in pulmonary. Repeat. P is
Ma'am,
pulmonary embolism.
okay. 3 months, 4 months, 3 days, 2 to 3 days. Radiation exposure background risk equal to 1 X-ray. Repeat X-ray in pulmonary embolism 3 months, 4 months, 3 days, 2 to 3 days. Ma'am, in pulmonary embolism, basically we do D dimers and these investigation. And
Yeah, but
X-ray
they
we
yeah.
will
This is
yes.
just asking
Yeah,
radiation
they're just
exposure
asking.
to
Yes.
X-ray is equal to how much days in active?
Radiations. Yes. They're simply just
Two
asking
to
you.
three days.
Okay, 2 to 3 days. Ma'am.
Yes. Again, it's a repeat one.
Okay. And drug of choice to treat heavy menstrual bleeding with history of asthma. Wish to start family within 1 year. Tranexamic acid, ma'am, we studied Myrina because she has to start a family within 1 year, not now, like after 1 year. And
Yes.
if she want to start now, then we will give tranexamic acid symptomatic treatment, and we will start her family as well.
Yeah. Exactly.
Because Myrina is first choice for heavy
Hmm.
menstrual bleeding. And some of our bodies contain calcium, and LDH is a tumor marker in dysgerminoma. It's
Hmm.
LDH. And Bartholin gland is located in superficial perineal pouch.
Hmm.
And Lane-Tall mechanism of action. Ma'am, what's
What is
Lane-Tall?
lentol? Yeah, even I I think there's something written wrong in it because it cannot be lane.
Wrong.
There's some lane toll because there's nothing like lane toll word. Have you
Okay, ma'am.
anybody
And
of you
maybe
ever heard it?
this paper is written by a student right after
Yeah,
giving
yeah,
her.
exactly. That is the problem.
Rubina, don't worry, we will do the same mistakes when
Okay.
we do this.
Listeria, which treatment amoxicillin, and which hormone maintain corpus luteum in the pregnancy? HCG.
Yes.
And test to compare unpaired and non-parametric chi-square or Mann-Whitney. That is
Hmm.
Mann-Whitney. Okay. For unpaired and non-parametric, yes, ma'am. And
Hmm.
for parametric, we will use chi-square.
Yes.
And pregnant lady with rash and fetal ascites parvovirus. And standard deviation of mean is in a normally distributed population 95 on a, for one standard deviation we have 95, for two standard deviation we have 97, ma'am, for two standard deviation na.
90, yeah, 95 for two standard deviation.
Ma'am, for one we have for one we have 68, for
Hmm.
two we have 95.
90, 95, 95.
Yes, ma'am. For three, we have 97 or 99, I think. 99.
98.9, 98 point something or 99 equal to 99. Yeah, just remember it
Okay.
99 for easy. Yeah.
Mm. Normal distribution curve, what percentage of data is encompassed by first standard deviation? 68%, ma'am.
Hmm.
2. And
Yes.
placental transfer of molecule through high lipid soluble will pass
Hmm.
the placenta. Structure form in the inner cell mass which divides it symmetrically and gastrulation occur in future. Primitive streak, notochord primitive streak.
Primitive.
Okay. Amniotic cavity,
Hmm.
Halden effect, deoxygenated hemoglobin carries more carbon dioxide. Okay.
Hmm.
Urethric bud from mesonephric or Wolffian duct. It is from mesonephric and Wolffian is a male organ. And graph showing fetal weight between 10th and 50th centile.
Normal.
So it's normal.
Hmm.
And development of the liver and biliary tract we studied it, septum transversum. And Whitline duct, ultrasound, anechoic ultrasound, abdominal ultrasound 226. Okay, it's the radiations.
Hmm.
Abdominal ultrasound 2 to 6 megahertz, and for TBS it is 6, I think, ma'am, or 8 megahertz. We
Yes,
studied
they're going to
yesterday, I
be.
think.
Yes.
Mhm. And chicken pox immunization, not exposed to the chicken pox, ma'am. They must have be a scenario.
Hmm.
And VDRL test, biological false positive. Okay. And Group B, neonate, Group B, streptococci neonate delivery after no swab, 4 days positive information, and neonatologist give antibiotic. No refer to neonatologist.
Hmm.
Ma'am, we will refer, but we will give antibiotic as well because we have studied that if it come positive, then antibiotic is given to the neonate.
Yes, very good.
And twin diagram in biopsy on 7th to 14th day of menstrual cycle, proliferative or follicular. 7th to 14th, ma'am, it's proliferative
Yes, 7 to 14 is
because it's
prolific.
menstrual. And in ovary, we will be having follicular phase.
Hmm.
Histologically proliferative. Arrow 1 was secretory. Phase 3 clinical setting shows efficacy of RCT or new drug only randomized trial with other gold standard drug. Okay. Progesterone only pill, most common side bleeding, ma'am, we studied erratic bleeding. And
Yes.
self-free fetal DNA is a source of placental trophoblast.
Mm-hmm.
And DAMPA mechanism of action is inhibition of ovulation.
Mm-hmm.
Ma'am, this cell-free DNA, there's a confusion between trophoblast and RBC. Ma'am, which is the most more appropriate?
But RBCs don't have.
You're
Okay.
saying you're having confusion between these two.
Yes, ma'am, we have up till now read that the
Fetal
Fetal
RBCs,
cell-free.
yeah, we have
RBC
already.
don't have nucleus, but ma'am,
RBCs don't have nucleus, so DNA
Yes, ma'am,
will
so
be
the
present
answer
in
should be
RBC.
I
placental
think,
trophoblast.
listen, Noor, I think so. Fetal RBCs are nucleated.
That I don't know. I'm
Yeah,
confused. I don't know the answer.
I've somewhere studied somewhere that fetal RBCs are nucleated.
But
Yes.
I think I studied in somewhere in this prenatal studies that it is the trophoblast cell. If fetal RBCs go into maternal blood, it will cause alloimmunization. Usually it does not occur. The
Hmm.
placenta is a barrier, but
Yeah.
trophoblast cells, yes, they do cross. So I think the answer should be trophoblast, but up till now we have studied its fetal RBC.
Yeah, we have always studied as fetal RBCs. Uh, okay, I'll check in the guideline in which guideline it comes. I think it comes in the guideline of blood transfusion. I'll check it today.
Okay.
Okay. And it is a metazolam act on GABA receptor, and labetalol is alpha beta antagonist.
Uh,
Selective alpha, non-selective beta blocker. It's uh, it's selective alpha, non-selective beta blocker.
yeah, yeah.
It's alpha beta blocker. I remember, ma'am.
Yes, it's
Labetalol.
alpha beta. So which one it is?
Select
A very repeat
non-selective alpha,
question. Very
non-selective
repeat.
alpha, non-selective alpha and beta blocker.
Yes.
Yes, ma'am.
Very repeat question.
Yes, ma'am. Hyperemesis with fluid to avoid 5% dextrose. Which fluid to avoid 5% dextrose? Hyperemesis,
And why do
which
we
fluid?
avoid 5% dextrose? Tell us.
Ma'am, it will cause, ma'am, it causes, ma'am, brain,
And Wernicke's encephalopathy
Yeah, it
will
Wernicke.
causes Wernicke's
use
encephalopathy.
vitamin
So yeah,
B1,
very good.
thiamine, and when we use dextrose, it will cause more and more thiamine uptake. So they will be reduced in thiamine and will result in Wernicke
Yes,
encephalopathy.
ma'am.
Yes.
Okay. Okay. And intracellular fluid, which ion is more potassium? And which layer ablated for menorrhagia? Basal layer. That is the functional layer of endometrium. But basal is not up to stopping bleeding there. It's on functional, I mean up to the serosa. Up to
This is
the
also
serosa, ma'am.
no. This is also a repeated question. We did
Ma'am,
this
we
one.
studied basal functional
Yeah.
layer.
Yeah, we
Yes.
said yeah. It's again yeah. There's something. It's
And
not
both,
written prop. Yeah, we studied as
Yes.
both the layers will be
Yes.
destroyed.
Yes. But ma'am, we can't move till serosa, then the whole uterus will be burned.
No, no, we don't go up to the serosa
Yes.
because if serosa is removed, then everything will go.
Last one.
We have the
Yes,
functional and
ma'am.
the basal layer that we remove in the
Yes.
options. They will be together. That has come.
And yes, ma'am. Perinatal mortality by WHO 22 weeks plus 7 days early neonatal mortality. It was 7 days and up to 4 weeks up to it's 7 days.
Hmm.
Perinatal mortality by WHO 20 week plus 7 days. Early neonatal. Ma'am, early neonatal mortality is till 28 days. Ma'am, we
Yes.
have 28 days and early neonatal is still first 7 days and
I
late
think
neonatal
after
is
7 days.
28 days after 7 days.
7 days.
Yes. And human papilloma virus type for high grade lesion is 16 and 18 and 6 and 11 is for wart low
Hmm.
grade. And question was 90% of genital wart by 6 and 11 it must be. 16 is high grade so it is not
Hmm.
causing warts. And molluscum contagiosum parvovirus. And these are diplococci so Neisseria gram negative. Smear taken from a patient with vaginal discharge, gram stain show following picture identify the organism. Okay, so it is diplococci. And umbilical cord section showing umbilical vein. Okay, two
Hmm.
umbilical arteries and one umbilical vein.
And there's
Yes.
two umbilical arteries and one umbilical vein.
Yeah, two umbilical arteries and one umbilical vein.
And caput medusa. Repeat question: which embryological remnant result in this? Umbilical artery, umbilical vein. Okay, they are asking from
Yes.
umbilical artery, but we get n from umbilical vein.
They're
Okay.
asking you capid medusa. It is a remnant of which of the following? Umbilical artery or umbilical vein? Tell us. It's again a repeat question.
Ma'am, I have
Yeah, you might have
studied
missed it. No, bro.
advanced,
Yeah,
but
yeah,
I
but
don't
tell us. Yeah,
remember.
but tell us. Give it a even give it a guess. So no,
Ma'am, I have read the answer, but I was not remembering it.
yeah. So
Caput
tell us what
medusa
you will.
by
Yeah,
the
it is.
opening of embryological remnant of umbilical vein.
Yes.
Okay. Fetal circulation showing ductus venosus.
Hmm.
Okay. What about NTD is given? I wrote surgical abortion. I wrote threatened. It's threatened. Ma'am, in surgical abortion, we will give
Yes.
it.
In surgical in like
And
if
we
you're
do
not doing
not
anything
call her.
conservative, we don't give NTD.
Okay. And in threatened, you should not give NTD. It is established bleeding up to 9 weeks, and after that, we will give it. And
Yeah, even I
less
can't
than
see what
12
is
weeks.
written inside that. Yeah. No, can't
Less
see.
than 12 weeks of gestation, no need of NTD in painless single episode of bleeding. Yes, ma'am. But when surgical intervention is planned, then 250 NTD.
Yes.
And
Before
after 12
20
weeks,
weeks, you give 250 units, and after 20 weeks, you
after
will give
that, we
500
give
unit,
500.
international unit of NTD.
And its uterine vein drain into the internal iliac vein, left renal vein. Ma'am, internal iliac vein.
Yes, which one, right or left?
Ma'am,
Hmm. Yes, tell us what it is going to be. Left or right?
ma'am, on right side, it directly drain
Hmm.
into the on the left side always it drain into left renal
Yes,
vein
very
always.
good. It is left internal.
Right
It
side.
drains into the left internal iliac vein. Yes.
Mhm. And question was left uterine vein drain into, so answer is left internal iliac vein. And maintenance of lactation through ductal dilatation, lobar hyperplasia, stromal hyperplasia, fat atrophy, one lobe. Maintenance of lactation through lobar hyperplasia
Yes, very good. Yeah.
and stromal because it was pregnancy, not after delivery. She is lactating 6 1. I think lobar hyperplasia.
Yeah,
It
it's a
was
repeat question. Yes.
Pain scale as variance. Analysis of variance. No ordinary man Whitney.
Yeah,
Pain
tell us.
is a
Pain scale will be, you'll mark as which type of
mild,
variable as pain.
moderate, or severe.
Hmm?
So it pain, ma'am. It is asking like mild pain, moderate pain, severe pain.
Yeah, so what type of variable it is going to be?
Ordinal.
Yes, very good. It's going to be ordinal.
Yes, ma'am. And man Whitney, ma'am. It is non-parametric.
Yes, it's non-parametric.
And there was a one question on discrete and nominal. Nominal is name, like
Yeah, color
blood
of the
group
eyes,
or
color of the
yes,
hair.
hair color or eye color or
Hmm.
these. And the discrete is the one in which points are also important, ma'am.
Yes, in which there are points.
Yes, ma'am. And in continuous, there will be a continuous data.
Hmm.
Okay. And ordinal, I know. And H. Dursey causes chancroid. And condyloma lata, secondary syphilis.
Hmm.
And placenta formation, lacunae develop in intermediate trophoblast, syncytial trophoblast, sure.
Hmm.
Lacunae formation in syncytial trophoblast will occur. And the nerve root for ilioinguinal and iliohypogastric albonitis repeat. A nerve injury during gynecological procedure and for adduction we studied obturator nerve. And nerve from medial border of source is also obturator nerve. And the nerve supply of the ovary is T10 and the level of umbilicus is also T10. And there was a question 20% transport albumin serum HBG HCG it is
Means it
oxygen
is going to be
estrogen
serum.
transport
Yeah.
estrogen in menopause.
Yeah, you have to tell them oxygen, like estrogen, it is transported through by which? Either it is transported through albumin or it is transmitted through sex hormone binding globulin. Tell us.
And sex hormone binding globulin.
And estrogen in the form of menopause, it is?
Ma'am, we have three estrogen E1,
Hmm.
E2, and E3. So, ma'am, in the in the in the reproductive age, we have E1,
Hmm.
and in the pregnancy, we have E3, I think,
Hmm.
and in the postmenopausal, we have E2. I
Yes,
don't
very
know.
good. In postmenopausal,
Yes,
we have estrone.
estrone. And albumin bind to the 20% estrone in postmenopausal. Okay, albumin bind. Okay. Also, question about premenopausal estrogen source granulosa cell. What is the term used for anti-cancer agent methotrexate, anti-metabolite? Ma'am?
Yes.
And anti-metabolite or cytotox. Ma'am, we use anti-metabolite.
Yeah, anti-metabolite, yes.
And commonest type of fibroid degeneration is hyaline degeneration. And the mechanism of the drug crossing the placental barrier, it is lipid solubility. Mechanism of action of methotrexate is antimetabolite and it's antifolate as well. And drug regarding magnesium metabolism doesn't HNG
Mm,
doesn't change.
does not change. Yes, yes, it does not change.
Okay. It was about excretion. Yes,
Its
excretion
excretion is
unchanged.
unchanged. Yeah, this is also a
Okay,
repeat question. We did this also.
okay. Nature of Winchcristine tubule attaches. Ma'am,
It attaches to
what is
microtubule. Then they're asking you the mechanism of action. It attaches to
nature of Winchcristine?
yeah. It's also a repeat question.
Okay. Landfall in alpha and beta agonist question.
I don't know what
Um,
is that landfall they're saying. I think there's something in this wrong they've written or
Letrozole is aromatase inhibitor. Okay. And nature of heparin, paper 2. Ma'am, if it was alpha and beta antagonist, then it was labetalol.
yeah.
And alpha and beta agonist, then it is dopamine, and these drugs are all alpha and beta agonists.
Hmm. But landfall, this is something problem with the
Mechanism of
question that they've not
action.
written it properly.
VDRL positive but other tests negative management. It was repeat question VDRL positive and
Hmm.
other negative, so false positive was answered, and we will not do anything. We have studied this question, ma'am.
Yeah, it was biologically false positive.
Mm. Most common type of CA in fallopian tube is adenocarcinoma, and in vulva, a squamous cell carcinoma.
Hmm.
And benign tumor histology shows spindle-shaped cell fibroma. And history suggestive of Meeks syndrome, mild pleural effusion present, so answer fibroma. Repeat
Hmm.
question. Okay, type of radiotherapy inside vagina, brachytherapy. And repeat question this was. And image of twins on ultrasound. Okay, this twin, and ma'am, there is present a thin membrane. It is diamniotic monochorionic twin.
Hmm.
It is T sign.
Yes, we did this now. This only. Yeah, yeah.
Mhm. It's T sign, and it is diamniotic monochorionic twin.
Yes.
Monochorionic diamniotic twin. And monochorionic diamniotic, there is no delta or lambda sign. For dichorionic diamniotic, lambda or delta sign is present, and for monochorionic diamniotic, T sign is present. And inner cell mass, amniotic cavity. And inner cell mass is basically, ma'am, embryoblast, no?
Yes, it is going to form embryoblast. Yes, in
Embryoblast.
the
And skeletal muscle is formed by paraxial mesoderm.
hmm.
And except we studied for the skull, that was lateral plate mesoderm. Other all skeleton is
All
formed by
from
the
the
paraxial.
asparagus.
And which is major type of adaptive immunity? Lymphocyte and Krukenberg tumor for GIT. That's why, ma'am, we when we do the ovarian Krukenberg tumor, then we remove appendix as well for the safe side because it is causing GIT tumor
Hmm.
as well.
Yeah.
And macrophages from
Ma'am,
monocyte. Yes.
ma'am,
Hmm.
about magnesium, previously we studied that it is metabolized in the liver and then it is excreted.
Give me magnesium. Okay, you have gone back.
Yes, ma'am. And ma'am, now you are saying that it
It was
is,
a here the option is not about that one option, no? That
ma'am,
we
that was
studied here.
also
It's
about
not written that
excretion.
option.
It was about excretion. We studied this was a proper question, ma'am.
Yeah,
And then,
over there, no. But here it's the question is not complete. Yeah, the answer will be the same if it's the same question.
so
Hey,
ma'am,
don't.
magnesium is excreted like it is metabolized in the liver and then excreted through the kidney.
Yes, it is metabolized through the liver and excreted through the kidney. Yes.
Yes, ma'am.
Okay. And which phase of cell cycle immediately precede mitosis? G2. And steroids secreted by fetal adrenal and placenta which hasten lung maturity, cortisol, ma'am. When we give delta dexa also for lung
Hmm.
maturity. And post sterilization has received morphine for pain relief. Inpatient for 24 hours. Now has pain on small cystic mass up to umbilicus, tender to touch, some oozing from the port site. Port site infection, ma'am. It's again
Hmm.
we studied it.
Yeah.
And null hypothesis question type 2 error. For hypothesis was falsely accepted. In null hypothesis is that we will reject it.
Yeah, the hypothesis is going to be rejected.
Yes. And type 1 error is that type 2 error is that we accept the wrong thing, and type 1 error is we reject the correct thing.
Hmm.
Type 2 error, the hypothesis was falsely accepted. Option type 1 and type 2. And formula of positive likelihood ratio.
Hmm.
Positive likelihood ratio.
Yes.
Sensitivity divided by
Ma'am,
1
it's
minus
that one
specificity.
Yes.
by 1 minus sensitivity
Yes.
divided by 1 minus specificity.
Specificity. Yes.
Yes.
Okay. Which enzyme in granulosa and lacking in theca cell? Aromatase enzyme.
Hmm.
Okay. Satori cell cleaning cell.
No, I think they've written in the options of this, like
Phagocytic
aromatase or
cells are Sartori cells.
Okay. Nature Samoma body is calcium. And nature of clue cell is epithelial cell, yes. And labetalol is alpha and beta antagonist, repeat. Antimetaboloite is methotrexate, repeat. Finasteride steroid, 5 alpha reductase, repeat.
Hmm.
Letrozole is aromatase inhibitor, repeat. Treatment of hyperprolactinemia, quinagolide. All options started with question best start. Okay. And we do not give what is it, ma'am? Carbigoline.
Yeah, Carbigo.
We didn't give it, yes, ma'am. And lithium toxicity affect which system? Ma'am, we studied its
Hmm. Tell us with effect.
CVS and
Yes, CVS.
and effect of tetracycline. Yes,
Hmm.
ma'am. And main effect of tetracycline is teeth and limb. Yes, ma'am. Teeth mostly
Yes.
is involved discoloration of teeth.
Hmm.
And repeat again, and glycoside causes ototoxicity, 8 cranial nerve damage. And then a type of genital mutilation after
Hmm.
clitorectomy. Repeat question. It is type 2 genital mutation
Type 1,
Type of
because in one, so answer is type
clitoris is
1.
removed. In type 2,
Okay. In
clitoris,
type 2, labia
yeah,
minora is removed, na? And type 3 majora is also removed.
yes.
Okay. So it's type 1. Okay. And a woman aged 35 to 45 years with right adnexal cyst like torsion with torsion like symptoms, diagnosis: cyst adenocarcinoma, dermoid cyst, peritoneal, pseudocyst, femoral cyst. Mm, ma'am, it can be dermoid cyst.
this is dermoid cyst.
Torsion. Yeah, the
Torsion.
answer is also dermitis. Yes, it's a repeat question. Torsion most commonly is associated with
Occurring in the
this.
dermoid cyst.
Hmm.
And plasma volume increase in pregnancy, ma'am. Trimester wise, in first trimester, it increase up till 15%, and in second trimester up till 50%, and in after third trimester, it is still 80%. Am I
Mhm.
right?
Yes.
So it's an overall plasma volume increase in pregnancy will be
Yes, tell
32.
us. It is
It's
also again a
plasma, sorry.
question.
Yes. So it's 30 to 50% or 15 to 30%.
Yes, you tell us.
Hmm. 30 to 50% B.
B. Yes, 30 to 50%.
Okay, ma'am. A case of difficult hysterectomy followed by abdominal pain. MRI show unilateral distended kidney and mass in the pelvis. This one I was confused between ureteric ligation and hematoma. Please help me. Okay. So, ma'am, most probably in hysterectomy, ureter is damaged. So it may be ureteric ligation and hematoma.
Yes. Yeah, there must be something like patient is unable to pass the urine or there's no urine
And
output in the catheter, something like
and
mentioned.
unilateral distended kidney is also present, and
Yeah,
mass is also in one
hydronephrosis
side.
will be mentioned. Some.
Yes, ma'am. And lateral umbilical fold contain which structure? Inferior epigastric vessel.
Hmm.
And question was medial ligament, not lateral. Okay. And what is the mechanism during breastfeeding which increase the flow and help it going for exclusive breastfeeding? Ma'am, hyperplasia of the duct. It's again lobular hyperplasia we
Okay.
studied.
Yes.
Ma'am, it is a diagram is showing corpus luteum
Hmm.
and filamentous insertion of placenta. And the one above is, ma'am, I think we studied it last time. It was fibroid, I think, or I
Yes,
don't
it is.
know this which is.
Yeah.
And ma'am, this graph, the following
Hmm.
intrauterine growth chart shows 10th and 50th centile. So it is normal.
Yes, it is normal one. It's the same graph
And
that
ma'am,
is repeated. Yes.
yes,
Ma'am,
ma'am. And now at the end they have given the pictures.
ma'am,
Hmm.
the picture above elementous insertion, what picture is this?
This seems to be which one you are asking? The below corpus luteum, na?
No, ma'am, this picture above elementous insertion.
Of placenta, they give it previously in the option, the same picture.
No, with this one you are saying above 5 centimeter on which or small top. For this one picture you are talking about
No, ma'am,
above this.
above this filamentous insertion, like the one is which is given this this is corpus luteum, right?
Hmm.
After corpus luteum,
Yeah, it seems to be something like fibroid or
and then filamentous insertion,
yes.
Yes.
and then a normal appropriate for gestation age.
Hmm.
Mm.
And ma'am, the other one,
Other one, you tell us what is this structure X?
ductus venosum.
Yeah, ductus venosus. Yeah, the same. The first three questions. They are the now the diagrams of that only.
Ductus venosum. And the one is Coombe test,
Yes,
And above
it's a
whom
direct
test
home test.
ECG.
the polar body, first polar body,
Yeah, that is the
Yes,
first
first.
polar body.
and ma'am,
And
the end one.
ENT, what it is? It is
Yeah.
testis or it?
No, this
Yes.
is appendicular testes, appendix of testes.
Okay.
Appendix
This
of
picture
testis.
is appendix of epididymis and appendix of testes.
Okay. So
And
Let's
Pratap,
see.
what about ECG
I'm
picture?
looking at it. I can't see it properly. Wait.
okay, ECG just the same ECG that we also did it previously. Okay, let me see. Yeah, I have the CTG picture, very clear one. Okay, let me see if I can find it now.
And these are tall, notched QRS complex in one.
Yes, they are not. You can see it very clearly. Okay, let me. Actually,
Am I
basically
saying
this one.
then the papers,
Okay, let me send it. Let me send it in the group. This is the clear picture that I have for this one. Yes, sir.
exam the questions are like the pictures are colorful or no, like
No, no, they are colorful. In the exam, it's a colorful.
okay.
Yeah, yeah. This is the correct
Sada,
picture. Yes.
Sada, what is the picture above velamentous insertion? What is it?
Ma'am is saying that it is fibroid. I'm not sure about it.
Okay, okay,
We
fibroid.
studied it somewhere in MCQs, and I was also confused at that time that which type of fibroid it is. But I remember that this picture was of fibroid.
Wait, I'm sending another picture as well.
And treatment of listeriosis is amoxicillin, right?
Yes.
Yes, amoxicillin.
Ma'am, the answer of this ECG is
Yes, you
third,
tell
Third
us.
degree heart block.
third degree heart flow.
Yes, third degree. Why third degree heart block?
Because after three P waves, there's one QRS.
Yes.
Ma'am,
Exactly. Hmm.
I'm sending a picture
Hmm.
and I'm reading it. Ma'am, please you tell me it is right or wrong. Okay, ma'am.
Okay, yeah, tell us. Send us. Yeah, send us. Let me see this now only. Uh, biologics. Yeah, you send us till then. I'm looking at that dog article. Let me find it now so I can.
And I've sent it. Check.
This is appendicular testes.
And one is appendicular epididymis.
The appendicular testes is fine. The appendicular epididymis.
Ma'am, I'm sending it that as well because one picture labeled I've seen this is like this. Appendicular testes is like look ma'am in this picture.
Yeah. Okay. This is appendicular and this is epididymis. Okay.
So ma'am, isn't it the same like
Yeah, it's
appendicular?
the same. Yes. Yeah. It's very similar to this picture.
So ma'am, this is right. I've rightly labeled it.
Marked it. Yes. Yes, appendicular testes and the upper one is appendicular epididymis. Yes, you marked it right.
Oh,
Okay, let me self repeat it again. Just I'm opening the article that I will study. Small petal vein thought origin from the trophoblast. Okay. High or low sensitivity of the test element. Yes, okay. Yeah, we had this confusion. Yeah, in the recent talk article. Yeah, what? If you can see. Yeah. Yeah, Nupur, can you read this lines for us?
Yes, ma'am.
Okay, yeah.
Basis of NIPT technique,
Hmm.
cell-free DNA comprises small fragments of fetal DNA thought to originate from trophoblast. These fragments circulate in maternal plasma and form approximately 10% of DNA fragments in maternal plasma. It is present in reliably measurable levels for aneuploidy screening from 10 weeks gestation and is cleared quickly from the circulation.
Yes.
Yes, ma'am. So it's
So it
trophoblast.
is going to, yeah, it's going to be trophoblast. This is 2017 dog. It's going to be,
So, ma'am, cell-free fetal DNA trophoblast.
yeah, selfie fetal DNA from trophoblast. Originates from trophoblast. Yeah. And yesterday we did also one question about the platelet transfusion. When we will transfuse a platelet? I don't think he were there. The option was not mentioned as less than 50. So just search. So whenever the options will be, just search for the option of less than 50 into 10 power 9. So that will be your
Ma'am,
correct option.
in
Hmm?
dengue, 20,000. So, like, this is for PPH specifically or just in general in UK below 50,000 they transfuse platelet?
Below 50,000 they transfuse
In PPH or in any condition?
in any conditions.
Okay, okay.
Hmm. Yeah, that is yeah. Yesterday when I was reading the guidelines, so immediately I thought just post it. Yeah. Any other question that we are having problem with? The small, this one was this centromere one, na? This side or which one was it, Sadaf?
Ma'am, the at the end of the chromosome.
Centromere at the end of the chromosome.
Somewhere it is written acrocentric, and we what we decided, we said it is
There
submetric.
was one thing I told you one thing that said centromere located at one side, and there was another thing that was located at one end. Something
Yes,
like that
ma'am.
was it?
Yes, yes. These
Huh?
two are the statements, ma'am.
Okay, I'll also will fine. We'll think in which guideline it comes, and we'll read that guideline. And we'll send you the, so that I can. Or it or either it means the question is same. It can be either be a single question that which of the chromosome it is centrome is located at one side. It must not be like the one at one end. It will be a single question. Just the people when they recall it, they must have written it wrong way. This can be one of the things. I'll go through the genetics guideline. I don't have it in, now here in front of me. I'll have to search. Going up that here it is placed. Any other question that we
No, no, no.
now try to have a good revision of you for you?
Ma'am,
Yes.
ma'am, I'm not studying since 3 days, 3 or 4 days. I don't know what happened to me.
No, no, inshallah, you'll do it.
Ma'am, I give my swab. I'm suspicious that I'm having corona.
Oh, COVID, yeah. Okay, so you did it from NHS?
Yesterday, yes, ma'am. That's why I
Oh,
didn't attend my class as
uh,
well.
mm-hmm. So you could have asked them to give the send you the kit at home. They do it like this also.
Ma'am, my husband took me. He told me, you like, I'm newbie here, so it would be better if you give there. than
Okay.
normal thin guys.
Oh, okay. Yeah, you took, because yeah.
Ma'am, I can't even move. I have so much body aches.
Oh, it's because you're sleeping late at night.
Ma'am, no, ma'am. This is not the way. I'm this from the start. I studied at night. Like I'm a night owl. Uh, I
Okay, okay.
I've lost my sense of smell, and I have blocked nose. I'm not getting what to do with my nose. I can't smell anything for days.
Oh, okay, okay. Yeah, then these are very related. No, no. Yeah, then it's good that you get it done.
Yes, ma'am. But let's see what happens.
No, no, inshallah, everything will be okay. But just try to continue. Even if you can't read the books, just go for the like this SBAs only, where the answers are directly marked. So just go and you can just revise them. So one thing is
And
easy
since
rather
three
than
days, I haven't studied anything. Today, inshallah, I'll try to study something.
yeah, yeah, do it.
Because almost we have done with all the course, so it would be better if I revise this in December. What this book is called, Oxford
Yeah, and
Review.
just last for the last few days for the like SBAs and
Ma'am, I will
everything.
do
Then
SBAs in last week because no use of doing a. It forgets, and I want it to be fresh in my mind.
yeah, yeah. Whenever if you feel in between you're tired with that, then you can go through the SBAs.
Okay.
And if there's any confusion, yeah, we'll come. We'll again, we'll just do it. We'll collect 2 3 points that we need to discuss, and then we'll do it. We'll have a class on that. If there's any confusion that is.
Ma'am, why not in between you prepare a 2 or 3 marks test for us? That's so much we know. We get to know.
Okay, I'll try because actually, like in 2 to 3 days, also I am also going. So I'll just
Yeah.
start preparing for. Yeah, I'm just starting to
Ma'am, I'll
prepare.
get you a book one after one day. How I'm gonna give you if you're going Pakistan?
No, no, I'm not going. Yeah, I'm going. I'll come back. I'll come back.
Okay, okay.
Okay, okay, yeah, yeah. I'll come back till then. Yeah, I'll be
Because tomorrow or day after tomorrow, I'll be
tomorrow.
free.
Yeah, yeah. You told me, na. Yeah.
Yes.
Just I'm waiting for the ticket to be finalized. Yeah.
Ma'am, you're from Karachi?
Yeah, yes, yes. I'm from Karachi. Yeah.
Okay.
I have to plan like when I have to go. Yeah, just because this is the thing that is like bothering. Yeah.
Yes.
No, meanwhile, whenever I'll just get a time, I'll just select the questions and make a file and we'll send it in the group so that whenever you get the time, just post it
Okay,
that
ma'am.
you can. Yeah. And meanwhile, yes, definitely before the exam, I'm going to have one mock test for sure. Like, make it either this 30th of December or 1st of January, something like that. I'll do it one for sure. One I have to do it. Yeah.
Okay, ma'am.
That
And
we will
ma'am, I
decide the
have
date so that. Hmm?
ma'am, I have missed many classes, so
Mm-hmm.
we'll be having a library assistant or exam now because
Yeah, yeah,
my
yeah, yeah, yeah.
exam
You
is
and yes,
having
yes, you and
tomorrow.
Fakra, yes, you will be having the assist till you give your attempt. Yeah, you'll be having your assist
Okay.
because
Thank you,
that was
ma'am.
an exceptional case that Pakistan did not have the exam, so it was not even
Okay.
your fault even. Yeah, that
Okay,
was
ma'am.
something.
Thank you, ma'am.
No
And
problem.
good luck for Nurpur and Sadaf.
Yeah, 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 definitely.
Ma'am,
Inshallah,
tomorrow
they're
there's
going
no
to.
class.
No, tomorrow there's no class.
Please, Rubina, do pray for me that I get through it. I have no
Inshallah,
other option than
inshallah,
getting passed
inshallah,
because I'll
inshallah,
be
inshallah.
jobless here.
No, no, you will be fine, inshallah, because here every person has got these symptoms as well. So we are treating symptomatically. So inshallah, and you will pass, inshallah, as well, and you will get well soon as well.
Inshallah.
Inshallah.
And inshallah, if I pass, I'll try my level best to help you out.
Yes, and we will not leave you, okay? So
No, 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 I'm not the way. I'm free. I'll help no one.
No, no, yeah, definitely. You first of all, you both have to write the proper recall questions. That is the most
okay.
difficult thing that
Ma'am,
people start
the
writing late
way
and
the
then
girls
it gets
write,
missed.
yeah, we will do it, ma'am. Inshallah.
Yeah, because those recall questions they really come again and again.
And Ma'am Sada will be writing tall. What was that MCQ? Tall, hell, or
I'll write that one girl has language as well in between.
No, no, do it. And one
But
thing what? Try to just do that also. What this pass MRCOG, the books also, the Andrew Sizer, because the questions they do come from this book also directly. The questions are taken directly, so that you can give more time to your stat question if you're having difficulty, or you're having any difficulty in any other
ma'am,
question,
please
so you can.
send a stat question in between. So please
Yeah, yeah, yeah,
try to
yeah.
write
Yeah,
because
definitely. Just because of the time difference, there will be time difference if I go. That will be the issue. But otherwise, definitely, I'm going to answer. Yeah,
yes, ma'am.
yeah. So just the time difference will be the issue. Yeah, just try to solve the questions, because they are really, because directly they come.
Okay,
So what will happen? It will save your time in those questions, and then you can utilize these time for your any other difficult questions which you want to.
okay, ma'am.
Okay. Any other questions? And whatever
No.
questions, just post in the group. Yeah, definitely, we'll answer them.
Okay, okay.
Thank you so much, everyone. Yes,
Ma'am,
Nupur
tomorrow
and
there's no
Fakra.
class, then?
Yeah, tomorrow there's no class.
Ma'am, tomorrow I'm traveling, so I have closed my mic, off my mic
Okay,
because
okay.
due to distortion.
Yeah. Okay, okay. No problem. No problem. Yeah,
Ma'am,
yeah. You both
is
are. Hmm?
tomorrow is there any class?
No, no,
No.
no.
Okay.
Ma'am, I'm also driving. That is why I've off
Okay,
my mic.
okay. Yeah. But yes, Nupur and for Sadak, yes, please try to just go through your books and questions, es- specifically these past papers and these questions. They're really going to help you. They come directly from there. There's no other way. And once you do it, you will find it easy. You will feel it that, yeah, you have, like, you will be 100% sure when you come out of the exam hall that, yeah, I've done 75 to 85 questions. Are my correct? Make sure that you do in each paper 75 plus should be correct in each paper, so that you're 100% guaranteed, yeah, that you have done this exam. Yeah, rest is on Allah. That what, yeah, rest is on Allah, but do your, give your best shot. Yeah.
Okay, ma'am.
Okay.
Sure.
Thank you so much, everyone.
Ma'am, please tell the instructor who is managing this group that put everything on the group so we can go directly from the site.
That, what do you mean? Sorry.
Like all the recordings and all the missed lecture recordings, he should.
They're not over there in the.
Ma'am, some are not there. Like PDFs are there, but some recordings are not there. So please, ma'am, tell him
Okay,
to put
recordings are
everything.
not there. Okay. I'll ask him, because I didn't go. I didn't go to the website since many days. I
Yes,
haven't
ma'am.
gone. Okay, so I'll ask him
Okay.
to do that. Yeah, rest whatever the problem is, just post in the group in the form of, either in the form of question, in the form of audio, whatever it is there, just post it. So we'll discuss it.
Okay, ma'am.
Okay, thank you so much, everyone. Allah Hafiz.
Thank you. Thank you.
thank you, ma'am. Allah
Thank
Hafiz.
you, Hafiz.
Yes, thank you, ma'am.